This is Pet Life Radio. Let's talk pets.
Welcome to ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm an emergency critical care specialist and toxicologist. Thanks for joining us today. Today, we're going to be talking about allergic reactions in dogs and cats. We'll be right back after these messages.
Does your dog itch, scratch, stink, or shed like crazy? Come to DACVECC for help.
Order a 90-day supply of DACVECC.
DACVECC is nutrition.
Pick up 2 bottles of LicoChops. Get the 3rd bottle free.
New improved LicoChops with omega-3, omega-6, vitamin E.
And now, 6 extra direct-fed microbials.
Even better for the digestive tract and immune system.
Try LicoChops. Buy 2, get 1 free.
At DINOVITE.com.
DINOVITE.com.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Today, we're going to talk about one of my favorite emergencies that I see almost every single day in the ER Vet. Now, this is allergic reactions. And I wanted to give you some hints when it comes to allergic reactions because sometimes it can help save you some money and get your dog or cat treated earlier. Now, I will say for you dog owners, you have to pay special attention because 95% of the time when I see an allergic reaction, it's typically in dogs. Now, dogs and cats are obviously 2 different species, but they also have 2 totally different types of allergic reactions. Thankfully, in dogs rarely have life-threatening allergic reactions. Don't get me wrong, it can definitely happen. If your dog is showing signs of an allergic reaction that don't respond to some hints that I'm going to give you, then you do need to get to your ER vet right away. Allergic reactions in cats are much less common, but when we see them, they can be life-threatening. So it's really important if you're worried your cat is having an allergic reaction, you want to seek veterinary attention, even if it's in the middle of the night, right away. And that's because cats can develop anaphylactic reactions. These are reactions that are really similar to if a human who's allergic to peanuts ate peanut butter or they're exposed to a bee. These can be life-threatening, severe, really fast reactions. Again, that's more of a cat thing and less common in dogs. Now, if you've ever had an allergic reaction before, you know it does warrant a trip to the emergency room for both dogs and cats. Most of the time, we never know what the cause of allergic reactions are. It's typically secondary to exposure to an antigen. You're probably wondering what an antigen is. Well, it's an allergen. It's just some type of molecule that your dog, or rarely your cat, is having a reaction to. Sometimes it can be from drugs like vaccines, certain medications, or even antibiotics. Sometimes it's from bug bites. If you left your dog outside and he comes in with a really swollen eye or puffy muzzle, this can be due to a bee or wasp sting. Sometimes it's due to chemicals in the environment, like household cleaners, new air fresheners, or carpet cleaners. It can be due to natural allergens like pollen or mold. And again, the majority of the time, we never find out as veterinary professionals what the inciting cause of the allergic reaction is. So, what signs should we look for? In dogs, signs of allergic reaction typically include a really puffy face. This may start out really small, where you notice a little bit of swelling around one eye, and then a little bit of swelling around the other eye, and all of a sudden you notice that your dog's muzzle is getting bigger and bigger. The lips start getting thicker. You may notice that your dog starts to have a lot of itchiness. They're using their front legs to itch at their eyes or rubbing their face on the carpet. If you notice redness to the skin, or the skin feels really hot or warm to the touch, you may notice little bumps, or what we call hives, all over the body. Your dog may be really agitated or restless. These are all signs of allergic reactions in dogs. And again, the majority of the time, it can be treated at a veterinary clinic really easily. I'll give you a couple of hints after our commercial break on what you can do at home. But remember, dogs rarely have life-threatening reactions, unlike cats. Now, signs of severe anaphylactic reactions seen more commonly in cats, again, they don't get that puffy face, those hives, the redness of the skin. Cats have very severe life-threatening anaphylactic reactions, and you have to get to your vet immediately. So signs of collapse or difficulty breathing, shock or abnormal heart rate, hiding or not moving, these are signs that you need to get to a veterinary clinic right away. We'll continue with this really important topic right after these messages from our sponsor for today's episode, Pretty Litter. A bag of Pretty Litter weighs 4 pounds, and it's really lightweight. Most litter weighs between 20 to 40 pounds. It's also long-lasting. One bag of Pretty Litter lasts an entire month for one cat. It's also got built-in health monitoring. It keeps tabs on your cat's health by changing color if it detects potential health issues. For example, Pretty Litter may turn green or blue if it notices a high urinary pH, which can lead to bladder crystals and stone formation. If Pretty Litter turns purple or red, it may indicate that there's blood in there. And this can oftentimes be a sign of bladder stones, crystals, bladder inflammation, or even a urinary tract infection. If you notice an unusual color, when in doubt, consult with your veterinarian to find out what's going on. We'll want to get a sterile urine sample, but it could be a helpful indicator by keeping tab on your cat's health. Pretty Litter also has microcrystals that absorb the urine and odor, so it's got amazing odor control. Also, it's easy maintenance. All you have to do is scoop the poop. No more clumping. Pretty Litter is delivered straight to your door every month with free shipping, so it's hassle-free and convenient. Go to prettylittercats.com/ERVet and use the promo code ERVET for 20% off your first subscription order. Today, we're talking about allergic reactions, and we can see this in both dogs and cats in the emergency room. However, the majority of the time when I'm working in the ER, it's almost 90 to 95% of the time dogs. As we discussed, dogs typically get skin reactions. They get a puffy face. They get hives. They don't typically have a severe life-threatening anaphylactic reaction. That's less common, but it's definitely possible. Cats, on the other hand, again, get severe anaphylactic reactions. So how are we going to treat this? Most of the time, treatment for an allergic reaction is going to include a couple of medications like antihistamines, such as Benadryl. The fancy word for this is diphenhydramine. Other medications are going to include glucocorticoids. These are steroids like dexamethasone or prednisone. Now, these aren't weightlifter steroids. These are steroids that your body normally makes in really small amounts. If your dog or cat is having an allergic reaction, we're going to use much higher doses of steroids to help decrease that inflammation in the body. For life-threatening reactions, again, anaphylactic shock in a dog is relatively rare, but it's possible, or anaphylactic shock in a cat, we're going to reach for the drug epinephrine. And this is rarely used. I will say I probably only used it half a dozen to a dozen times in my 20 years of being a veterinarian, but this is used for severe life-threatening reactions of shock, that elevated heart rate, that low blood pressure, that difficulty breathing. And if we do see those severe cases of allergic reactions, your pet definitely needs to be hospitalized in the emergency clinic. This is going to include treatment with oxygen, steroids, epinephrine, blood pressure and heart rate monitoring. And most of the time, your dog or cat is going to need 24-hour care for at least 1 to 2 days to make sure that they respond to treatment. Now, if you're just noticing a really mild reaction at home in a dog, you can always consult with your veterinarian or your ER vet and potentially treat it at home. Now, again, hear me out. This is only for really mild cases, and this is only for dogs. But you can potentially use Benadryl at home. You do want to make sure that the Benadryl only contains the drug diphenhydramine. Again, that's a scientific brand for the drug name Benadryl, but you absolutely must make sure there are no other ingredients mixed in. You can't have any other ingredients. Otherwise, that can actually be poisonous to your dog. Now, the dose of Benadryl in dogs is typically 1 milligram per pound of weight of your dog. And again, I'm only going to advocate for this in dogs. So If you have a 10-pound dog, you're only going to give 10 milligrams of Benadryl. If you have a 50-pound dog, you're only going to give 50 milligrams of Benadryl. Now, I will say there's a pretty wide dose range of Benadryl in dogs, and sometimes you can go a little bit higher. So in extreme cases, if your dog doesn't respond, I might redose them 4 to 6 to 8 hours later, up to 2 milligrams per pound of body weight. When in doubt, please contact your veterinarian or even the ASPCA Animal Poison Control Center to verify if the dose is correct. If you notice after a few doses, your dog's not getting any better, or if the swelling is getting a lot worse, your dog is having difficulty breathing, your cat's having a reaction, please get to the veterinarian right away. And that's because we're going to use stronger drugs that we give in the vein to be able to treat it. So if you're hesitant to treat your dog at home, no worries, just get to your ER vet right away. We'll know how to treat it. My last tip is if your dog's having an allergic reaction and you bring them home from the ER vet, sometimes bathing them will actually help. And I will oftentimes recommend bathing with a liquid dish soap like Dawn. I love Dawn because it's really gentle. In fact, they actually use Dawn to help remove oil from wildlife during oil spills. I like dogs to be bathed with Dawn because sometimes there's actually what we call a contact allergy. So your dog may actually have pollen or mold or some type of chemical on them that may be triggering the allergic reaction. So as long as your dog is stable, once you get back from the ER vet, it's worth considering bathing your dog with a liquid dish soap like Dawn just to get that pollen or allergen off. Thankfully, the majority of the times when I see an allergic reaction in a dog, it's just going to be mild. Yes, the facial swelling looks terrible. Yes, their puffy eyes make you really heartbroken. But the good thing is the prognosis is excellent. Check with your ER vet, get them to a vet right away, get them started on Benadryl or even steroids like prednisone. And thankfully, really within a few hours, up to 1 to 2 days, that reaction should completely resolve. So don't be too worried about allergic reactions in dogs. Again, they're the most common cause that I see dogs coming into the emergency room, especially during the spring and summer. But thankfully, the prognosis and outcome is excellent. So your dog is going to do just fine. Well, that brings me to the end of today's show. Find me at drjustinelee.com, on Facebook at Dr. Justine Lee, or email me any of your pet questions at drjustine@petliferadio.com. With that, we're out of time, and we'd like to thank Mark Winter, our producer, for making this show possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.